physical therapy.
Affirmative. Agreed. I agree. Of course. Yes, yes, yes.
Geriatric health promotion and wellness, special focus on falls. Fall facts. Falls occur due to long-term and short-term predisposing factors as well as short-term precipitation factors in a person's environment. A fall may be a sign of an acute pathology. For example, a patient got urinary tract infection. A fall may be a sign of progression of a chronic pathology. Example, patient got Parkinson's disease or other movement disorders. 1/3 of people over the age of 65 fall each year. 1 out of 10 of those falls results in serious injury. Falling accounts for the majority of injury-related deaths. Most common is the hip fracture. Falls resulting in injury or hospitalization result in decreased likeness of returning to the prior level of function. The fear of falling. 30 to 50% of the elderly are afraid of falling, even if they have not fallen before. Fear of falling is associated with decreased physical and social activities. Fear of falling is correlated to a decrease in your walking speed. So, the patient walks, it increases the risk of falls. The risk factors of falls. There's a presence of 4 or more risk factors that may increase the risk of falls to 78%. Intrinsic factors originate within the individual. Extrinsic risk factors originate outside the individual. And most often, extrinsic is environmental. What are the intrinsic factors? What are the intrinsic risk factors for falls? You got some impaired balance, lower extremity weakness, decreased flexibility. For example, there's tightness in your Achilles tendon. That means there's posterior weight shifting and loss of balance. For example, there's tightness of hip flexor. So there's anterior weight shifting and there's loss of balance. Slow walking, decreased reaction time, decreased activity levels, impaired vision. It's all related to falls. Postural hypotension, decreased attention recognition, depression, fear of falling, previous falls, and side effects of drugs like psychotropic drugs, antidepressants, antiarrhythmitics, and sedatives can cause falls. What are the extrinsic risk factors for falls? Extrinsic. It could be the surface, which is slippery, uneven. It could be the stairs or the curbs. It can also be the footwear. If it's poorly fitted, it's not secure, it feels loose. It could be the lighting, the contrast. It could be the sun's glare, reflective surfaces, dark environments, and high-risk activities. Walking and falls. Walking. The walking speed gradually decreases with age. It decreases more rapidly after the age of 60. Decreased gait speeds result in increased risk and frequency of falls. Falls while turning are more likely to result in fracture than falling while moving in a straight line. Avoid turning. because you might fall. For the adults, a, aged 60 above, gaits and falls, walking and falls. Assessing the gait speed. How fast do you walk? The 10-meter walk test requires 20-meter walkway. Time the middle 10 meters. It is reliable, inexpensive, and easy to perform. Yeah. Assessing the walk speed. If you do not have access to a 20-meter walkway, 5-meter walk speed is feasible, reliable. Assessment tools for falls. You have the Berg Balance Scale, Timed Up and Go, TUG, Functional Reach for upper X and lower X, Clinical Test for Sensory Integration, Clinical Test for Sensory Interaction and Balance, Modified Clinical Test for Sensory Interaction and Balance, Activity Specific Balance Confidence Scale, Falls Efficacy Scale, and Health Status Short Form 36. There's a lot more. What's the Berg Balance Scale? The Berg, the Berg Balance Scale is a 14-point scale. It is suggested that the scale with cutoff scores to so the scores below 45 indicate increased risk of falls. It is more recently been suggested that to use the Berg Balance Scale to predict risk for falls, as falls in older people are multifactorial. So aside from Berg Balance Scale, you could also use other balance tests. Berg Balance Scale is used in a wide variety of populations, including patients in the community dwelling, elderly, patients with brain injury, multiple sclerosis, orthopedic surgery, osteoarthritis, Parkinson's disease, spinal cord injury, stroke, traumatic and acquired brain injury, and vestibular dysfunction. Another test that you can use is the timed up and go. It is a quick and easy assessment, including transfers, gait speed, and turning. It's easy to perform in any home or therapy setting. It is measured by the amount of time needed to complete a task. It is suggestive of increased risk for fall. Testing, it could be used. You can use it for. You could also use it for patients with Alzheimer's, the frail elderly, acute medical patients, healthy children, patients with low back pain, rheumatoid arthritis, also patients with stroke, SCI, Parkinson's, and patients with vestibular disorders. Hmm, Okay. Another test that could use is the clinical test for sensory interaction and balance. It assesses patients' balance under a variety of conditions to infer their source of instability. The test conditions include number 1, stand on a firm surface with your eyes open. Number 2, stand on a firm surface with eyes closed. Number 3, stand on a firm surface with a visual conflict. Number 4, stand on a foam surface with eyes open. Number 5, stand on a foam surface with eyes closed. Number 6, stand on a foam surface with a dome. Visual conflict. The CTSIB considers a visual, proprioceptive, and vestibular input. It could be used on a variety of populations, even in pediatrics. Could be used in neurologic cases and orthopedic cases. Okay. Activities specific balance confidence scale. Another test is the activity specific balance confidence scale, or the ABC scale. There are 16 items which are self-reported, testing in a wide variety of populations, including the elderly, patients with multiple sclerosis, Parkinson's disease, stroke, unilateral transtibial amputation, and patients with vestibular disorders. It is graded from 0% to 100%. Walk around the house. Are you 100% that you will not lose your balance? 100%. Walk up or down the stairs. Completely confident? 100%. Bend over and pick up a slipper from the front of a closet door. 100% completely confident. Reach for a small can off a shelf at eye level. 100% completely confident. Stand on your tiptoes and reach for something above your head. 100% completely confident. Stand on a chair and reach for something. 100% completely confident. Sweep the floor. 100% completely confident. Walk outside the house to a car parked in the driveway. 100% completely confident. Get into or out of a car. 100% completely confident. Walk across a parking lot to the mall. 100% completely confident. Walk up or down a ramp. 100% completely confident. Walk in a crowded mall where people rapidly walk past you. 100% completely confident. Bump into by people as you walk through the mall. 0%, no confidence. What if those people are like Triple H? It'll be like, or the Big Show. They bump you. You're gonna fall. Okay. Step onto, on, or off an escalator while you are holding on to a railing. 100% completely confident. Step onto, on, or off escalator while holding on to parcels such that you cannot hold on to the railing. 100% completely confident. Walk outside on icy sidewalks. 0%, no confidence. Man, that's hard. And then you get the total ABC score divided by 16. And that's the percent of self-confidence. Another test that you could use is the false efficacy test. There are 10 items in this test, and the cutoff score is like more than 80 increased risk of falling, more than 70 indicates a fear of falling. On a scale of 1 to 10, 1 being very confident, and 10 not being confident at all. So it adds up, alright? False efficacy scale. Activities. Take a bath or shower. Very confident, 1. Reach into cabinets or closet. Very confident, 1. Walk around the house. Very confident, 1. Prepare meals not requiring carrying heavy or hot objects. 1. Very confident. Get in and out of bed. Very confident, 1. Answer the door or telephone. Very confident, 1. Get in and out of a chair. Very confident, 1. Getting dressed and undressed. Very confident, 1. Personal grooming, like washing the face. Very confident, 1. Getting on and off the toilet. Very confident, 1. Total score is 10 over 10. Another test that you could use is the Health Status Profile, short form 36, also called the SF36, because there's 36 items. There are 8 subscales of this test. Okay. Number 1 is the physical functioning. The physical functioning, the role limitations due to physical problems, the general health perceptions, vitality, social functioning, role limitations due to emotional problems, general mental health, and health transition. Okay. For example, the general health, it would be asked, would you say your health is good? Yeah, it's excellent health. Compared to 1 year ago, how would you rate your health in general now? Well, it's about the same. Limitations of activities. The following items are about activities you might do during a typical holiday. Does your health now limit you in these activities? If so, how much? So you're gonna answer yes, limited a lot, yes, limited a little, and no, not limited at all. In vigorous activities, such as running, lifting objects, participating in strenuous sports. No, not limited at all. Moderate activities such as moving a table, pushing a vacuum cleaner, bowling, or playing golf. No, not limited at all. Lifting or carrying groceries. No, not limited at all. Climbing several flights of stairs. No, not limited at all. Climbing one flight of stairs. No, not limited at all. Bending, kneeling, or stooping. No, not limited at all. Walking more than a mile? No, not limited at all. Walking several blocks? No, not limited at all. Walking one block? No, not limited at all. Okay. Stopping elderly accidents, deaths, and injuries. Stopping elderly accidents, deaths, and injuries provides resources for clinicians. They give you screening tools, interviews, questionnaires, fact sheets, and education. You could find it in the CDC. What are your interventions to prevent falls. So, if you combine a lot of interventions, it could be an effective method of fall preventions. Individuals with cognitive impairments or dementia are generally less successful with fall prevention interventions because they have dementia. Screen Screen to identify individuals at risk. Screening. Obtain accurate fall risk assessment and identify the risk factors. What are your interventions? You should give emphasis on individualized programs, on the potential limitations such as impaired cognition, vision, hearing, and other non-modifiable risk factors. There's also personal preference for home versus facility and individual versus group. There's a specific lifestyle modifications and individual motivation and encouragement. In physical therapy, what can they do to prevent falls? A PT can do screenings, patient education, physical therapy interventions like strength training, flexibility, balance, and gait training. They can also give family education, home safety evaluation and modifications, and adaptive equipment training. So, home modifications. You can do some home modifications to reduce risk of falls. Home modification, in the absence of combination of interventions, is not effective in fall prevention. So, home modification is not enough. So, you have to combine it with other modifications of interventions. So, aside from identifying um, some home modifications, you should also combine it with other interventions. So, the basic things that you can see as hazards in the house are the tripping hazards, lack of railings, grab bars, slippery surfaces, unstable furniture, and poor lighting. So, these are the common recommendations: non slip mats, remove clutter or tripping hazards, install grab bars, use raised seats and toilets, improve lighting and contrast, have sturdy chairs with armrests. Okay. Assessments and risk factors. So there would be some risk factors, and how would you give intervention to it? Okay. So there's like problem and solution. Problem: previous fall. Solution: modify your home environment and activity and have some safety evaluation of your home. Problem: medication use. Solution: review and reduce medication when appropriate. Of course, you have to collaborate with the doctors. Problem: visual acuity, glaucoma, cataracts. Solution: give ample lighting with avoid multifocal glasses while walking. Refer to ophtha and optometrist. Problem: postural blood pressure, postural hypotension. Solution: check medications, adequate hydration, consider compression garments, decrease sodium intake, and implement some compensatory strategies. Um, Slow down your transfers and just take it very slow so you don't lose your balance. Another problem, balance and gait, including self reported unsteadiness and impairment. Solution, balance training and referral for assistive device training. Problem, targeted neuro exam, including proprioception, cognition, muscle strength. Solution, raise attention to deficits and incorporate cognitive program as needed. Problem, targeted musculoskeletal exam with emphasis on lower extremities. Solution, strength training, flexibility, stretching program, special attention to limitation in dorsiflexion and hip extension. And so, those are your falls for geriatric population. Peace. This is Mo PT.